We are here in Chicago at the ASCO annual meeting 2013 with Dr. Matthias Preußer from Vienna, Austria. And we would like him to talk to us a little bit about the recent results that were presented here in brain tumors.
Okay, well, we had a very interesting ASCO from the perspective of brain tumor research. We saw interesting data on glioblastoma. Glioblastoma is the most common brain tumor in adults, primary brain tumor in adults. It's a tumor which has a median overall survival of about 14 months. So it's a devastating disease, and we are desperately in need of better treatments. One of the main focus of brain tumor research in the current time is anti-angiogenesis, because glioblastoma is characterized by a lot of microvascular proliferation in the tumor and expression of VEGF-A. And so what was done now is to test the drug Bevacizumab, which is an anti-VEGF antibody in this disease, and we saw several trial results here at ASCO. One large trial performed by the RTOG, it's called RTOG 0825, randomized about 900 patients. One treatment arm received the standard chemoradiotherapy after resection, and the other arm received the same treatment plus the antibody. Here was seen that if you take all comers, so any patient with newly diagnosed glioblastoma, there is no benefit of adding Bevacizumab. However, we saw in this study and also in other studies that specific subsets of patients are very likely to benefit from Bevacizumab. For example, the GLARIOS trial, which randomized in a 2-to-1 fashion in glioblastoma patients newly diagnosed with unmethylated MGMT promoter. These are the patients not responding so favorably to chemoradiotherapy. He was randomized between Bevacizumab plus irinotecan versus chemoradiotherapy with temozolomide, and here we saw a benefit in terms of PFS improvement and overall survival improvement for the Bevacizumab containing regimen, which is very interesting and needs to be substantiated in further phase 3, preferably trials. And another point here is that we need to standardize MGMT testing, because this indicates that it could be a potential predictive factor.
You said that in the study there were a subgroup of patients who demonstrated not such a negative response like the others. Worth further investigating the characteristics of these patients?
Yes, definitely so. So the investigators performed translational research in addition to the trial. They looked at mesenchymal genes expressed in the tissues and found that patients with a mesenchymal kind of gene expression profile do not profit much from Bevacizumab treatment, while the others seem to do so. I think there are patients who benefit from Bevacizumab. We need to figure out who are these patients.